I hope everybody can see and hear me properly. We can start our live immediately. Now, before going to our live, there were some questions on my WhatsApp and Facebook regarding different miasms and other things also. So whenever these doctors come online, I will basically try to give you some answers on that. One question that was asked. So before I go to that question, I don't know the doctor is online or not. Before I go to the question, just tell one case where just we got a very fantastic result. There was one case, where the patient told me that I could have done so much in life, I could have done so much in life, but because of some problem, because of this problem, because of that problem, I was not able to do that in life. And because I was old, because I could not see properly, because I could not walk properly, I would have done a lot of things in life, but I was not able to do that in life. Of course, I gave 2 or 3 remedies which failed. He was suffering from severe gastritis, acidity, and ulceration in the stomach. So as I gave him the remedy, there were few remedies which I gave. I gave him lycopodium, I gave him China, but did not give result. Then I was just reading the case and I tried to interpret his symptom in the repertory form. And I got a very interesting symptom in delusion. I prescribed the patient the remedy hydrogen, and to his utter surprise, the patient was so happy. He came after 15 days and he told, "Sir, give me this medicine only. This medicine is working like magic and I am much better with that." Now, if you understand this case, this is just a summary of the one-line case which I would summarize in this YouTube. Just tell me, why did I give the patient hydrogen and the rubric which I took for prescription. Listen the case again. The patient came for severe gastritis, acidity, ulceration in the stomach. The patient also had Barrett's esophagitis. The patient was 62 years of age. The crux, the summary of the case was that the patient told that I could have done lots in my life, but because I cannot see properly, but because I cannot walk properly, but because of my stomach problem, I feel so, I did not do what I wanted to do in life. This was the summary of the case. I prescribed the patient hydrogen and the patient is much better within 15 days of giving hydrogen. I gave him previously lycopodium, then China. It did not work, but this medicine had a fantastic effect on the patient. So which remedy, I have told you, which symptom or which rubric or what do you understand in this case? If you are able to tell me, then we can proceed with this case. So good afternoon, Dr. Prajapati, Navjot, Dr. Babal, Dr. Bharat, Dr. Potency hydrogen. I gave the potency. I normally start with 30 and then go to 200. But in this case, I started with 200 only and the patient is much better. As I always tell to my students, to my, all the doctors, that what remedy did I give is not so important. How did I analyze the case? How did I approach the case? What rubric I took for prescription? And as you all know by now that I'm taking my life for the past 5 to 6 years, and my approach is basically, I only prescribe on 1 or 2 or 3 rubrics, the summary of the case. Good evening, Dr. Vinci. Yeah. So that is how I approach. So let me tell you, let you analyze the case and let me, you decide what I had given the remedy and why did I give the remedy. That's important. So just one question which I had on my, good afternoon, Dr. Barwatkar, Gambal, Dr. Padde. So the question was tics. Now what is tic? First of all, tic is a sudden repetitive motor movement or vocalization that is not rhythmic. That is not rhythmic and involves discrete muscle groups. Discrete, not rhythmic, repetitive. Now, if you see these 3 words, automatically you will understand what I am talking. Now you can, this is rubrics only. We have a rubric tick also, and you see, you can have directly jump to the remedy also, but I will not give you that, is so, because jumping into remedy will never give you the remedy right. Secondly, tick must be distinguished from movement disorders. We have chorea, we have dystonia, we have myoclonus, we have OCD. Now, if you differentiate this, normally, tics is basically it is in relation to mind. How does the and why is the body behaving in such a way? So you can keep thinking about these symptoms like repetitive disorders, repetitive movement disorder, vocalization which is not rhythmic. That is important. The rhythm is lost in the patient's mind. This is the entry point of the case. Are you with me? So let me give you the question first. And now that hydrogen you have to tell me. I'll just take few questions. Sir, what medicine can be prescribed for cholinergic urticaria, especially if it is started after acne suppression from medicine? Now in homeopathy, my dear friend, whatever it is, if it is suppression of acne, suppression of diarrhea, suppression of dysentery, suppression of sweat, few medicines are very, very common, and the first one is sulfur. In your case, think about sulfur first, second think about bovista, third think about calcarea carb, and fourth think about, there's again an interesting evidence, syphilinum, which has given me good results. Good afternoon, sir. Aged 45, female, pain in neck to right shoulder, radiates to right chest, right elbow, worse by raising the hand when the combing the hair, disc bulge C5, muscle pain, entire body. See, this is a typical case of nerve compression, especially right side. So if there is a nerve compression, especially right side, the nerve is involved. There are few medicine. See, understand what the patient tells you. Bubbling sensation, numbness sensation, as if thousands of ants inside, as if crawling sensation, more in the evening, more in the night, more while working. It depends on this. Right side, you must think, and so much involvement of right side, think about simple remedy for right side, argentum nitricum, semisefuga, ruta, belispar. I had a very interesting case which really improved with gelsemium of late. This was the case. Good afternoon, Indranil. So what would you watch? What can you do about ticks? It's really bad this year. Even people who seemed immune are affected. There are mass of them, and it makes you want to go out in nature into the garden. Very nice. Now, as I told you, ticks, tick. Now there is a difference between tick, TIC. Now it's a mental disorder. I always tell you, and if it is involving a mass, that means lot of people are affected by this thing. That means the cause is defined. Now let me tell you, in homeopathy, actually don't get confused between tick and tick. What tick I told you was TICS. I think what Dr. Babel wants to tell me is TICK. Now if it is TICK, it is absolutely different. Now you have to understand in this, tick are small bugs, that can be hard to spot, and when they are crawling on you, there are tick bites, and that can spread very dangerously, like limb disease, or there is one disease called as Rocky Mounted Spotted Fever. That is also important. In this case, 2 or 3 things are very important, Dr. Babel. 2 or things are very important. First of all, if in local site there is some psychosyphilitic symptom, for example, there is a lot of redness, there is a lot of itching, there is a lot of burning, there is a lot of pain, which type of pain, and then the generalized symptom of myalgia, chills, rash, lot of things. So there are few remedies which are very, very common in ticks. They are very, very common. If you go now, forget the diagnosis. Forget the diagnosis, Dr. Barbal. Just understand that it is a bite. It is a bite which is caused by a tick, and the symptoms are this. There are few remedies which are very, very important, and it is not that it is not in India. It is in India also. It is there. So few remedies which I use in my practice. First, think about epismel. Second, think about Merxol. Third, think about Silicia. Then Rustox. Then Anthraxinum. Then Chamomilla. Then sulfur. Then creosote, Dulcamara, uh, and so forth. I think there was a case where we prescribed Dulcamara to the case, Dr. Babel, and the patient is much, much better. So it is never that you have some symptom, different remedies and disease there. It is symptom which is important. Lot of inflammation. I had a case where there was a lot of inflammation, just belladonna cured the case. I had a case there was lot of itching until the patient used to, scratch the skin so much that the patient used to take out the skin also. I prescribed sulfur, it failed, and then I prescribed Helonius, that cured the case. One case after the tick, there was lot of swelling, there was so much swelling and redness, it was like a boil. Epismel cured the case. So it depends on the local symptom first, syphilitic part on the surface miasm, and then how has the body reacted. That is important. Okay, I hope I am clear. If there is a case, then I would be more clear. सर एक पेशेंट को ओसीडी सेक्सुअल इंटेंसिव थॉट है, इंटेंस प्योर है, बंदा या so Dr. Akil, whatever I can understand the case, there are few remedies which I use in my practice, and first is ornithogallum. Ornithogallum has given me so many good results. In fact, if there is a case where I do not get symptom and then I give ornithogallum, it has cured the case. Second remedy, very, very important, Dr. Akil, is Cantharis. Remember this remedy, Cantharis. Third remedy, again very, very important, cannabis sativa. Cannabis sativa. And then you can have remedies like Veratramal or Natramur, other remedies. But these 5 remedies have given me very, very good results. Remedy for rheumatic spasm of skeletal muscle. See, rheumatic spasm, now just take that the patient has got a lot of spasm because of rheumatism, there is a lot of spasm. So there is a systemic disease first, and it is causing a local symptom. So go to the case taking, see why the patient is in so much spasm and so much fear. Got it, Dr. Padde? Hello? Got it, Dr. Indraneet? Numbness is there, think about semicifuga, think about B12, think about lachesis, think about ranunculus sulf, not bulbosus. Rheumatoid arthritis involved upper limb curved finger. डॉक्टर साहब प्रजापति जी, एक rheumatoid arthritis से मैं क्या बोलता हूँ, it is basically a disease of systemic involvement. So you cannot treat all parts. Still you can think about angustera, you can think of arrhenia, you can think about causticum, you can think about rhododendron, you can think about macphos, you can think about these remedies. But I'll not be happy by giving these medicines with only one symptom. Okay. So skin cyst medicine, homeopathy. Skin cyst के लिए there are a lot of medicines, doctor sahab. Cyst, of course, when the word cyst come, whether it is in skin or any organ, there are few remedies which are very, very important, doctor sahab. Think about Silicia, think about Calcarea, think about Ruta, think about Bellispur, think about Calcarea fos, think about Carcinosine, think about Syphilinum. Okay? With skin itching, Dr. Praja. Yeah, so yeah, whatever remedies I have told you, Dr. Prajapati, it is the same. Severe sneezing in every rainy season in 33 years, male, Dulcamara helping little. See, whenever you are prescribing on sneezing, basically, what happens, doctor, I don't prescribe on sneezing only, because when I was very young in my practice, I used to give either Sabadilla, arsenic, Orendo, Allium cepa, and the patient is much better. If it was not better, I used to increase the potency, increase the repetition, and then the patient used to come to me after 3-4 years suffering from bronchitis and then asthma. So from sneezing to asthma. So in sneezing, just tell the patient to just maintain the hygiene and all. That is more important than giving medicine, unless it is hampering the patient's day-to-day life. Okay. Skin cyst medicine I have told you. Okay. So these are the only medicines which I can think about now. Otherwise, there are a lot of medicine, doctors. You can go in the repertory and search. But then my approach towards homeopathy is never, very local. It is all case taking. But in cyst, I have told you, still if you want, you can think about Bratacarb or Calcarea or Epismel, Graphitis, Cilicia, Phosphorus, nitric acid, Sabina was also there, Causticum, these are all remedies there, And sebaceous cyst just one note that in sebaceous cyst, the Thuja and Graphitis have helped me wonderfully. Okay. So Dr. Babel, did you get something about tick? It is TICK. I was talking about TICS. I hope Dr. Babel, you understood something about that. The area where the tick is there is not so important, but what are the local symptoms, and because of the local symptom what it has affected the constitution, that is more important. I had a case of tick where the local side there was nothing, but the whole patient was suffering from a lot of pain in the muscles, could not walk, just was lying in the bed holding his pillow, clinging and all. In that case, Gelsemium 1m in water doses cured that patient. So this is understanding which is the most prominent miasm at that, whether the locally it is more important or the whole personality is involved, that is more important. Otherwise, in tick, you can have a very inspiring lecture, but I always tell lectures can be very inspiring, but from that lecture, whether it has increased your practice, clinically it is important. So in my case, my lecture would not be so inspiring, but if you think Mater Medica, if you think symptoms and my remedies, you'll be a better prescriber and a better practitioner. Okay. I hope, Dr. Barbal, I hope you are listening and understanding what I want to tell you. Okay. So let us go forward. So what I gave hydrogen, I had given you exercise, why did I give the patient hydrogen? That is important. Anybody? Why did I give the patient hydrogen? Now can you give me that answer? Anyone? And what rubric or what symptoms I took for prescription? Yes, Dr. Pandey, Dr. Pandey, Dr. Disha, Dr. Bharat, Babel, other. I have asked you the question. The case was gastritis which was cured. What remedy? I gave the remedy hydrogen. What symptoms I took for prescription? That is the art of prescribing, doctor. Okay. So there are no answers. So let me go forward. Try it. Okay. So let us go forward. Now there was a case. No answers. Okay. So I was just talking something about. There was a case. So patient came to me, and he said that, Doctor Sahab, whenever I am out of India, he was in Bombay and he was working in a machinery factory. Because of the marketing job, he used to stay outside for 50 days out of India and 50 days in India. So he says that whenever I am out of India, I am absolutely fine. There is no problem. But as soon as I come to India, I have a problem of urination, there is cystitis, there is burning, there is itching, the urethra, a lot of things are there. But out of India, I am very happy. Now, there was a very typical symptom in this case. Of course, I gave the patient 3 remedies, 4 remedies. He was better until the remedy was taken. When the remedy, after that, I had to change the remedy because he was not better. And I asked, what do you like out of India? So he had recently gone to, Dr. Babel will be very happy, to Germany. I think the Black Forest area. And he told that it is so beautiful there, no? I said, what is beautiful? He said, there are no people. There are so less people, you can breathe properly, you can drive properly, you can eat properly, and there is everything is open. Still, I was not, getting the rubric. I took the rubric, better in open air, likes open air, wants peace, wants tranquility. Still, the patient was temporarily better. Are you with me? Are you with me? Then I took the rubric, elements from crowd in society. There are a lot of remedies. I just added few symptoms and I prescribed the patient single dose of Thuja 1m in water dose. Hello, Thuja 1m for recurrent UTI, and believe me, next time he came to India, when he came to me when he was going out of India, he said, Doctor Saab, in this 15 days, I have had no urine infection. Please continue this water medicine. So I gave him placebo and told him to take twice a day. And he said, no, don't give me this. This does not work. Give me the medicine which I have to take in water. 4 pills in water, 1 spoon thrice a day. Give me that medicine. So I gave 5 term in different bottles. Every day take 4 pills in half cup water 3 times. And he's coming for me for the past 4 months in Bombay. And he has no infection, no UTI, no burning, nothing. This is the importance of converting the patient's language in the rubric form. Are you with me? Hello? It is not where is the patient from, where is the patient. It can be anywhere from North Pole or South Pole or Kashmir to Kanyakumari. It is not important where are we treating the patient. It is important how are we interpreting that rubric and converting into the converting the patient's language into rubric form. If you see that rubric, I have used that rubric not so much in my practice, but I also failed thrice and 4 times. And then I got to the rubric elements from crowd in society. There are a lot of remedies, of course, but then I prescribed Thuja, which cured the case. Are you with me? Hello? Hello? If you understand, just write something so that I know that you are understanding what I am teaching. I have been teaching for 5 years. I have not seen you in live. Only I have seen the German group in live, which I was very happy. So that's why if you are understanding it, write something. If you see Thuja, there are a lot of symptoms of Thuja, but in this case, what symptom I took for prescription? Elements from crowd in society. Now coming to hydrogen, which is the remedy, which is the symptom which I took for prescription in hydrogen. What was the patient telling me? That I am 62 years age because I cannot see properly, because I cannot walk properly, I cannot do this, I cannot do that. I would have done so much in my life, but I could not do it. Hydrogen cured the case. The only rubric which I took for prescription, my dear friends, was delusion, crippled old man that he is. Are you with me? Delusion, crippled old man that he is. If you go to that rubric, there is only one remedy, and that is hydrogen. So this rubric, whether the patient is in India or the patient is out of India, he is in any part of the world, the rubric would be the same. Are you understanding what I want to tell you? Anybody? Everyone? This is the importance of converting the patient's language into rubric form. If you don't write anything, I feel that I am talking to the computer. Sometimes it is like that. So do write something so that I know that you are understanding what I want to tell you. Yeah? Navjot, Prajapati, Indranil, Padde, Babal. This is the importance. So I think there is, if there is no other symptoms, other questions, let me talk something today about hydrogen. Now I'll be talking only hydrogen, what I've seen in my practice. Now why I prescribe hydrogen? There are a lot of questions, but I cannot see any questions. My assistants are telling me that there are a lot of questions, but I cannot see any questions. No, I cannot see any questions. The last question is from classic short creator, skin cyst homeopathy. Otherwise, I cannot say anything. I don't know why. But my assistant doctors are telling me there are a lot of questions. So I'll just complete. Now hydrogen, how did I first prescribe hydrogen? There was a typical case, of sulfur, when the patient had, that typical symptom of sulfur, that only rags are very good, and the patient used to come to me by wearing green pant and blue shirt, and I thought this is sulfur, and it did not work. So when I was reading hydrogen, I got one symptom, delusion, things looks beautiful. Delusion, things look beautiful. This is the first symptom of hydrogen which I saw in my practice. In that case of sulfur, I prescribed the patient hydrogen, and next time when he came to my OPD, he was wearing very decent clothes and decent combination clothes. So this was the first symptom, the first case in my life. I prescribed hydrogen. And then when I was reading hydrogen, doctor, when I was reading hydrogen, some doctors asked me something about sneezing. Now there was a symptom of hydrogen. There is one symptom of hydrogen. Yeah, so one of my assistant doctors has wrote me, elements from cow. There are many medicines. Why only Thuja? I told you one thing, no? I took some other prescription, other symptoms of Thuja also, which were very, very common. That's why I told you how did I land up in Thuja. Not only single symptom. I took other symptoms also of Thuja. If you want, I will tell you something of that also. But I know that there are some symptom of Thuja. But okay, I'll tell you some symptom of Thuja which are very, very important, and I took for prescription. One symptom of Thuja which very, very was important in that case was in anxiety. There was a lot of diarrhea. Whenever he had anxiety, he had diarrhea. Whenever he had anxiety, he had diarrhea. Okay, so that was the second symptom which I took for prescription. And I don't know, there are no questions coming here, so that's why I gave the patient Thuja. So let me come back. I hope whoever is asking the question, he understands what I want to tell you. So now let me again go to hydrogen. There was the first symptom, hydrogen. Secondly, in hydrogen there is one symptom, that is unification with higher consciousness. Remember this symptom, my dear friends. Remember the symptom, unification with higher consciousness. It is not only God, it is that you are unified, and then you can connect to the spiritual part of yours, connect to the dynamic part of yours. That is also hydrogen. One question my assistant has told me on the WhatsApp. Any medicine of thin semen, hair fall, graying with no weakness. When you have these type of symptom, thin semen, remember one remedy which is very, very important, which I have in my practice. Phosphoric acid, Thuja, selenium, and one medicine which I want to tell you. Remember that medicine, Avana Sateva, Ashwagandha, alfalfa. I had one case which I tried everything, it did not work. Avana Sateva 1 ml single dose cured the case. Okay, so one more question. Head psoriasis for past 3 years, has dandruff, gone for surgery. I don't know why he did. I don't know for which surgery the patient has gone. But psoriasis, let me tell you, I have never given psoriasis for specific medicines. Psoriasis for head, there are medicines like Kalisulf, Vinca minor, Sorinum, but I have never prescribed on local symptoms. In psoriasis, it is always elements from stress, from dominance, from mortification, humiliation, suppression. This is psoriasis. So I cannot answer this question with a remedy because I have never seen this type. Okay. So Dr. Babal, I hope you understood something about tick, T-I-C-K. Okay. It is curable. Limb disease is curable. We had prescribed Dulcamar. I hope that patient is also much better with that. And I hope that case of migraine, I have a lot of cases of cured migraine. The theory, the approach is very different in my. I hope that case of migraine also takes my medicine and she'll be better. Okay. So let us go forward. Hydrogen, I was telling you. In hydrogen, so there's one more question. I don't know why the questions are not coming on my computer. So there's one more question. Male, 54 years of age, warts on the body, red wart. See, first of all, you have to differentiate between red wart and cherry angiomas. There are a lot of people, who suffer from red eruption type. Those are called cherry angiomas, and normally you can't do anything for cherry angiomas. But if you feel the wart is red in color, so you can try few medicines. I have, only few cases where I have got. You can write down. You can write down nitric acid, causticum, Thuja, and calcareous carb. One more question. bite of centipede, swelling, tingling, blackish, sensitive to touch. Now, whenever a centipede bites, remember that whenever a centipede bite and there is swelling and there is tingling and blackish. Now, in this case, I'll just tell you how to approach a case. Now in this case, tingling is okay, swelling is a psychosis now, but the patient has discoloration, blackish, my dear friend. That is syphilitic. That is syphilitic because the blood supply has been compromised. So go to that syphilitic part to prescribe. I hope, hello, are you with me? Today I'm not getting questions on my computer. So blackish discoloration, don't give epismel first or don't give this smell. Now blackish discoloration, first remedy arsenic album, second remedy sickle core, third apis mellifica, fourth crotalus horridus, fifth lachesis. Whether it is a centipede bite or a tick bite, if the local symptom of the body is showing you some syphilitic symptom, prescribe on that. Hello, are you with me? Are you understanding, my dear friend? Hello. Are you with me? Okay, it is already half an hour up. So thank you all. Thank you for joining, and I hope you enjoyed as much I enjoy sharing my knowledge with you. So until next Saturday, thank you and goodbye.